I think if it's easy to make contact with your local IBD specialist team, that's always a good idea. A lot of the patients now will have phone numbers and email addresses for IBD nurse specialists that they can get in contact with, and that's always a good idea. Having said that, on the other hand, I'm perfectly willing to be very supportive of any colleague in primary care who decides to treat an acute flare, as long as we get to know about it as soon as. Oftentimes these things might arise when a patient is going off on holidays, or maybe has an important occasion coming up and their disease is flaring up a bit, and a brief course of steroids is okay in such a setting. We would always prescribe concurrent bone protection with steroids, but really certainly we would want to know about it and see the patient before the course of steroids has run out. It's important to note a number of patients with left-sided ulcerative colitis, when they're flaring, don't require steroids. They just require a bump in the dose of mesalamine, and that's something that can be done relatively safely and effectively. There isn't a one-size-fits-all approach to these, and I think it needs to be taken on an individual case-by-case basis, but certainly I think gastroenterologists in general will be very, very open to knowing about these patients, and when they're in trouble, taking phone calls and discussing it with our primary care colleagues over the phone.